National Chronic Care Advisory Committee is a subcommittee of the Interdepartmental Technical Working Group. The Council has oversight over successful implementation of the comprehensive integrated NCD prevention strategy towards a healthier Virgin Islands. So one of the primary objectives of this subcommittee is to provide leadership and advice to the coordination and integration of primary, secondary, and tertiary prevention and treatment of NCDs across all sectors. It will therefore monitor the successful implementation of the Integrated Community-Based Chronic Disease Management Action Plan and will provide leadership, coordination, and advice on all relevant legislation, standards, policies, and treatment protocols to improve more timely and efficient patient-focused services. So the purpose of the subcommittee is basically to coordinate, strengthen, and make recommendations for the standardization of care on NCDs across sectors, and to work towards the integration of self-management, diet, physical activity as part of standard treatment of care for NCDs. Also to improve the quality of care, avoid duplication, and reduce the burden of chronic disease and all related risks. The membership of the committee is quite wide. It involves government, NGOs, health services. I'm not sure how many members are present today, but BVI Cancer Society is represented by Ms. Gloria Foy. Health Services Authority by many individuals, including Dr. Alea Khan, who will present on one of the activities of the committee. BVI Red Cross, Ms. Helen Frett, yeah, she's in the back. Ms. Ivy George, who I think is ubiquitous across most subcommittees. Myself, Ms. Jacinthe Hannibal, who is the Chief Nursing Officer. Ms. Margaret Lewis, President of the BVI Diabetes Association. Dr. Sagalo, who I know is not here. Ms. Gracia Wheatley-Smith from the Ministry of Health. Ms. Rudy Mae Thomas, who's our secretary. And the doctors Vanterpool, Harlan and Hesketh. We have, since I've taken on the chairmanship of the committee, we've had 2 meetings, and we have 4 items on our agenda. 2 items will be presented on subsequently. That is the chronic care leadership team by Dr. Khan. And I'm not sure if Ms. Hannibal is here, but she will also present on the self-management program. The chronic care program is basically a patient-centered care using latest evidence and using a multidisciplinary approach, and Dr. Khan will expand on that. Ms. Hannibal is also handling the self-management activities. Again, that is a peer education program where individuals are educated on various ways to deal with all chronic disease. So it's a very generic program. The two other activities we have from the program, from the committee, are: one, we are developing a list of guidelines specifically to look at screening for chronic diseases. So these guidelines will be very useful for example, the National Health Insurance, so that persons are screened appropriately using the latest evidence. So we don't have excessive screening or inefficient screening. The 4th item is something we refer to as a PASIC survey, which is a survey looking at persons who are under care for chronic disease. We're looking at their perceptions of the quality of their care. And that survey is to be carried out before the implementation of the chronic care program and a year afterwards, so we can look at the impact. So from our committee, those are the 4 main items we are trying to get done this year. Thank you.